are members who are making contact with their local branch representatives who are being told that, the HSE can't facilitate their return to work. And I'm boggled by this because, there are inevitably, no matter what way you slice it, there are always people on maternity leave in various different professions,
It's a bit like cat and mouse, if I'm very honest, Deputy. But in recalling the previous hearing by the CEO and the SecGen, my recollection is it's up to 10,000 agency workers are in existence, which is quite alarming. And to me, that's much higher than it has ever been in the HSE. And you can see that in the figures that they gave us through our FOI, that increase.
I work on a daily basis with our members and I'm in workplaces talking to them. So normally there's a range of different issues come up when I go into a workplace. Now the number one issue in every workplace is the vacant posts and the problem that that's causing.
I started in the health sector in 2007, a couple of days before the last moratorium hit. So I know all about it and what it's like working through a moratorium, and I was a locum at that time. And at that time I was one of 3 locums in the entire hospital. So it was jumping from Billy to Jack, like covering jobs here, covering jobs there, filling the gap to make sure that the services were run. And we've gone down that road again.
We have members who are being asked to do the jobs of other professions. Say, for instance, social workers leave their jobs, there aren't enough social workers left. Social care workers are now being asked to do the job of social workers. These people are working in difficult jobs at the best of times. It's unrealistic for anyone to do, the work of 2 or 3 other people as well as their own job.
On the 31st of December 2023, thousands of jobs were decommissioned by the HSE under the pay and number strategy. These were funded and approved posts.
Just to capture the feelings of the members on the ground, Fórsa initiated a survey last year. Over 4,000 of our members completed it.
And it just basically shows that morale is down. It shows that people are burnt out.
88% of those that responded said that they have vacancies within their department. 73% of respondents said the pay number strategy and the embargo was having a negative impact on themselves, and 74% said it was having a very negative impact on service delivery.
Before Christmas, the lunchtime protest really gave an opportunity for our members to show their frustration, show their anger at the situation, and come out and show solidarity with each other as well. You had all the different roles, all the different grades, all the different unions coming together as a strong, united voice.
We already have very long waiting lists and it's going to endanger more people.
I never thought I would consider being burnt out doing my job. I love my job, I love what I do, but it can't continue. It needs to change.
My eldest child will be turning 16 and I will not have been able to use my full parental leave allowance for that child. That's incredibly demoralising. Staff won't be able to keep going the way they're going.
We know that this is not sustainable. Ye know this is not sustainable. The HSE know this is not sustainable.
Last few years it's going on and they are not giving us enough staff.
Well, people have been asked to come out regardless of the weather, show the HSE in Bernard Gloucester that we mean business.
Even when we're getting holidays, we're having to say, can you come in off your holidays? And that's not really great for anybody.
We won't have staff left. They are starting to walk. People are actually leaving the health service at this stage because they can't see an end in sight.
The stress gets to people, the worry gets to people, anxiety, and so it's not a great place at the moment. Every car coming past is waving out the window, they're beeping their horns. People are behind us, people know what we're going through.
We deal with people with very small babies to very elderly people living in the communities, and they are impacted.
We are not accepting this anymore. We need to protect ourselves, our staff, we need to protect our services and our patients.
Thousands of members showed up on their own time at lunchtime to show their stress and frustration. The emphasis on the recruitment of agency staff is only masking the problem.
There is a claim that there isn't enough money to provide staff. but yet there is a huge amount of money that goes into private consultancy and also to agency staff as well. Most of the agency staff that I speak to would prefer to be directly employed, and there's a lack of understanding as to why there's so many agency, and there's an unwillingness to recruit direct employees when agency staff cost a lot more money.
If they're pregnant, if they're sick, they've no job security, they've no job certainty, they're not being offered full-time contracts. For example, in Kilkenny, we had a lady who was pregnant, and because she was being offered 2-week rolling contracts, at the end of the 2 weeks, she'd get a new one. But now she's at home with a new baby, and she has no certainty of a job when her maternity leave is over, because they can't promise her that they can bring her back. They have no idea.
We've highlighted this issue in the media, we've surveyed our members, we have attended the Oireachtas. We have tried fruitlessly over the last year or more to engage with the HSE on this issue to try and find a solution to this problem.
You just feel like you're banging your head off a wall all the time, because the health service is unique in the fact that, like, they're like a big family, and there's a caring element, and they're passionate about the job, and they want to make sure that it's covered. And then they're afraid to take leave. You always have that guilt and like pain in your stomach, going, the thoughts of what's going to happen, who's covering me, like there's no cover anymore. And like the flexibility, work-life balance, forget about it. Like,
health services operates as a system, and without the people at the front line, the health and social care professionals, the clerical staff that man the front desks, the rest of the system can't operate.
Everyone is as important as everybody else. There's no one any more important, like even down to the person who goes to get the medical record. Somebody has to go retrieve the actual chart and bring it back so that the doctor can read it.
This is an important issue. The staffing of the health service is one of the most fundamentally important things that the government can do in this country.
There's not a house in the country that's untouched that doesn't use the health service at some shape or form throughout their life, or they all need it at some stage. And it's when you need it, it's when you see it. I would love that the HSE would engage with the unions and they would actually listen.
Our members voted 93.6% in favour of industrial action up to and including strike action. The turnout in the ballot and the turnout at lunchtime protests show how willing members are to stand up for services and to stand up for quality healthcare delivery in Ireland.
I'm not the union, you're not the union. We collectively together, united, are the union. This is a battle for the future of the health service. We're only going to win this if we come together.